Talk on asthma in a special population, that is a pregnancy, pediatric, elderly, and status asthmaticus. Asthma in special population and status asthmaticus. I am Dr. Rajendra Nanavare. I am a chest physician, academician, and researcher. So let's introduce asthma is a chronic inflammatory airway disease affecting all the age groups. Special population, pregnant women, children, and the elderly require individualized treatment. Individualized treatment approach due to unique physiological consideration. So, status asthmaticus is a life-threatening exacerbation requiring urgent intervention. Asthma in pregnancy. First, prevalence and impact. Asthma affects 4 to 8% of pregnant women. Poorly controlled asthma can lead to complications like preeclampsia, low birth weight, preterm delivery, and fetal hypoxia. So, physiological changes and asthma control. Hormonal shift, that is a progesterone and estrogen influence bronchial tone, increase oxygen demand, and reduce lung capacity due to gravid uterus can worsen symptoms. So, treatment guidelines. Stepwise approach as per GINA, that is a Global Initiative for Asthma guidelines. Now the safe medication, inhale corticosteroid, ICS, budesonide, first line therapy, beta 2 agonist, salbutamol, formoterol, short and long acting bronchodilators, Montelukast, safe and effective. Avoid systemic steroids unless necessary. Regular fetal monitoring and, maternal spirometry. Pediatric asthma. It's a unique challenge. Asthma is the most common chronic disease among children. Infants and toddlers have a smaller airway, making them more susceptible to obstruction. Common triggers: allergen, viral infection, exercise, smoke, exposure. Clinical presentation: recurrent wheezing, nocturnal cough, breathlessness, exercise intolerance. Symptoms often misdiagnosed as recurrent respiratory infections. Management approach: inhale corticosteroids, that is ICS, fluticasone, budesonide mainstay of treatment. Leukotriene receptor antagonist LTRA, that is montoleucos for mild persistent asthma. Nebulized beta 2 agonist salbutamol during exacerbation or attack. Spacer device improves inhaler effectiveness. Trigger avoidance. Dust, dust mite, pet dander, pollution. Vaccination. Influenza and pneumococcal are recommended. Asthma in the elderly. Unique consideration often misdiagnosed as COPD, that is a chronic obstructive pulmonary disease. Coexisting conditions like hypertension, diabetes, osteoporosis complicate the management. Polypharmacy increase the risk of drug interaction and side effects. Treatment modification ICS plus LABA, that is a budesonide plus formoterol, is preferred to minimize systemic steroid use. Long-acting muscarinic antagonist, that is a LAMA, tiotropium may be used in severe cases. Oral corticosteroid should be avoided unless absolutely necessary. Pulmonary rehabilitation and breathing exercises, pause sleep breathing yoga. Osteoporosis risk with steroid, consider calcium and vitamin D supplementation. Status asthmaticus. It is its definition and pathophysiology. Severe persistent asthma attack unresponsive to initial treatment can lead to respiratory failure, hypoxia, CO2 retention, cardiac arrest. The clinical features: severe dyspnea, tachypnea, silent chest, altered mental status, paroxysmal paradoxical respiration, sign of impending respiratory failure. ABG finding, arterial blood gases finding. Initially, respiratory alkalosis, that is low CO2, later respiratory acidosis, that is a CO2 retention, and that's a bad prognosis. Emergency management, stepwise approach, high flow oxygen, maintain SpO2 or saturation of oxygen more than 92%. Nebulize SABA, short acting bronchodilator, that is a salbutamol, plus iptrotropin over 20 minutes for first hour. Systemic steroid, that IV methylprednisolone or oral prednisolone. 1 to 2 mg per kg. And fourth is the IV magnesium sulfate, 2 gram over 20 minutes. It has got bronchodilator effect. Non-invasive ventilation, NIV, if impeding respiratory failure. 6 is intubation and mechanical ventilation if patient deteriorates. So now, in conclusion, asthma is a manageable in all population with proper treatment. Pregnant women, children, and the elderly need tailored therapy. Status asthmaticus is a medical emergency requiring aggressive intervention. Early diagnosis, adherence to the guideline, and patient education are the key to better outcome. Thank you.